Welcome to Basic Black. Some of you are joining us on our broadcast, and others of you are joining us on Facebook and Twitter. I'm Callie Crossley, host of Under the Radar 89.7. Tonight, minority businesses face reopening the economy. We, like you, are dealing with the effects of the coronavirus pandemic and are taking precautions. We are working with limited staff, and our guests are joining us remotely. It's been a little over 2 months since Massachusetts stay-at-home advisory forced non-essential businesses to close their doors. As we've seen, minority businesses not only lost income, but most were shut out of stimulus funding. Governor Baker's 4-phase plan for reopening kicked off last week. But will some minority companies never reopen? And how will the ones still standing manage a new, costly way of doing business? Joining us, Irene Lee, chef and owner of May Restaurant in Boston. Dr. Jonathan Collins, assistant professor of education, Brown University. Dr. Collins developed questions for the recent 2020 COVID-19 poll of African American voters by the African American Research Collaborative. Nia Grace, owner and operator of Daryl's Corner Bar and Kitchen Restaurant in Roxbury. And John Cruz III, president and CEO of the Cruz Companies, a family-owned business that is also one of the oldest minority-owned businesses in Roxbury. Welcome to all of you. So I'm starting with you, Jonathan, because one of the things that your poll asked directly was of your African-American voters, we want to be specific that that's the group that you were looking at, were they feeling comfortable, those voters, about reopening and what reopening would mean? And 80% of them said no. Please explain.
Yes, that's correct, Callie. Essentially, we found overwhelming support for the idea of maintaining the shutdown. There were immense concerns about safety heading into reopening the economy. We saw a clean 80-20 split, which we think firmly suggests that African Americans are very much cautious about the idea of reopening economies around the country.
And why did most of them say? What were the indicators that gave them pause?
Well, I think the biggest indicators are how much trust that they have in the public health officials, and that there's information coming from, whether it's the CDC, Dr. Fauci, and some of the public health officials nationally are sending messages suggesting that we're just not quite ready. And I think it's the combination of what's coming in from the medical elites, as well as the news coverage continuing to show how African Americans are disproportionately impacted by COVID-19. This is causing real fear and trepidation amongst African Americans when it comes to reopening the economy.
Okay. Let me move over to you, Irene Lee, because you had to shut down and sort of regroup during this stay-at-home advisory, as so many restaurants did. What happened during the time that you were out, and are you ready to reopen for dine-in customers? Because that's really it. Restaurants could do takeout, but not dine-in.
Exactly. The first thing we did was move as much of our staff online as possible. So giving people assignments for remote work and having them work on different administrative projects. Right now, we are doing takeout as well as running virtual classes and doing some other donor-funded community work. But the truth is that we are not ready to reopen. May is a really small restaurant, and we rely heavily on catering revenue to make our business model work. And so for us, we're really looking at totally redefining what May is and trying to find a different way to be a restaurant.
Nia Grace, same question to you. You bought Daryl's Bar and Restaurant Kitchen in Roxbury in 2018. So you're a relatively new owner. Are you feeling ready? And what happens in the shutdown? Did your takeout continue?
Mm-hmm. So absolutely a new owner. Will be 2 years, or I'll be the owner as of 2 years in September. Once we had to shut down, in fact, takeout was less than 2% of our income. It was more something that was passive for us. So we had to really regroup when we talk about doing things quickly. It was that Monday that we found out that we would have to close our dining rooms that Tuesday. And I had to make a decision if we were going to be open for takeout by that weekend. I did it, and we've been doing takeout ever since. The first 2 weekends were really, really tough. It is not what much like Irene, that is not what our business model is made of. For the months of March, April, and May, we were expecting a heavy catering push as well and private events because of graduation season. We lost that completely, especially as the colleges were closing down and sending their students home. So for us, it has been the takeout right now, but when you are used to doing live entertainment and having a really good craft cocktail program and dining and service, it is tough. And to the question of, are we ready to open? I don't believe we're ready to open, not because of the guidelines that the CDC has given us or some of the parameters that the National Restaurant Association is talking about, but more so, we don't think our customers are ready to, in fact, come out and dine in our spaces yet.
Well, and in fact, WGBH and Boston Globe poll did survey some potential restaurant goers, and a good number of them said 3 to 6 months is really what they needed to just have a little, about 28%, before they'd feel fully ready to go in. And even then, they'd want a lot of other safety precautions. But we'll come back to that in a second. I'll move over to you, John Cruz, because you've opened, such as, the construction was able to open up before the restaurants and dine-in, that's yet to come. And so you've done it slowly, but you felt a little bit more prepared to face both the shutdown, which was not something that you wanted, of course, and to face the reopening. Tell us about it.
Well, we were fortunate being in the kind of business we are, and I'll make the quick right here, that the number one businesses that go out of business and bankruptcies, and I haven't checked in a while, but it was for a while, was restaurants first and contractors second. So it's a very risky business to begin with. But in construction, in order for you to grow to a sizable company, you have to have bonding. And bonding requires you to have what they call retained earnings or profits kept in the company more than other businesses, because it's such a risky business. You have to have a certain amount of net worth, and that determines how much bonding, how many jobs I can get. So most companies, if they've been around for a while, have reserves that they can go through before they get to a stage that they're really in trouble. And that's because construction is so risky. I can have one job that can wipe out 5 years of profit, and it's happened before. So we were more prepared because we had money, and because of the requirements of so much reporting, we had the staff, clerical, accounting, and we have to have outside CPAs to do audits for both the bank and the bonding company. So we were able to hit the ground running. So that's why we were able to fare, and we're back to work, and we're probably 80% efficient right now. We're just getting into it. All the new requirements are making it more costly and a little more difficult to do it, but we will, it will be a cost that will have to be passed on to the owners, and so somebody's going to pay for it, but that will be absorbed in the cost. So we feel that we'll be back to work normally in about probably only about a month for people to get used to these new restrictions on construction. And where it's more open, it's not quite as risky as interior people in the crowds. It's a little easier, I think, for us to feel more comfortable that we're not putting people's lives in danger.
So let me pick up two things that you said. First of all, you were able to get some of the stimulus funding because, as you said, you've been around a while. You had your business stuff, your reserves, so you were able to connect and pick up some of that stimulus funding across your company, which was helpful as well. But also, I want to talk to you about the new costs of doing business. Now, you mentioned them, but the personal protection equipment that most customers in any business are going to require, even if you're doing work outside, is new and costly. What's your estimate of how much more it's going to cost you to do business now?
Well, I would say on construction only, because of the protocol, and which hasn't even settled out yet, it's probably going to raise the cost up somewhere between 3%. I don't think quite it'll get up to 5%, but still that's a lot when you're dealing with jobs that could be $10 million, $20 million, because it also depends on what you're and where you're located at.
Right.
But
Okay.
I would say 1 to 3% is going to be in the construction.
Okay. All right. And Nia, I want to come back to you because you mentioned that in passing as well. What's your estimate, given you're starting from scratch a little bit because you didn't have the takeout model. You're trying to get ready for opening, and now there's the additional cost of this personal protection equipment.
Yeah, I mean, I think we're looking at not in percentages, but thousands of dollars in terms of new sanitation stations and the equipment, and then we're also thinking about when we get to that point of on-site consumption, trying to utilize outdoor space. So between fees and furnishings for us to be able to do that, we're looking at a heavy load on top of any of the bills that we've already had accumulated during this time.
Okay. And Irene, now you're something of a restaurant justice warrior anyway, before COVID-19, just about looking at how minority restaurateurs have not always been in the whole thick of things that happens in Boston. I look at the list of people who are making decisions about guidelines for the restaurant and reopening, and I don't see any persons of color. You would know better. Did I miss something?
I don't think you missed much. I think that we're all sort of in a situation where we are looking at who's creating the guidelines, who's doing the advocating, and we're wondering if people are really advocating for us. And I think that's why, as business owners in the restaurant industry, Nia and I have to make our own decisions about what's best for us, what's best for our staff, and for our guests. And so it can feel a little bit lonely to think that the folks who are holding the power don't really represent us. But that's why we have to stick together. And the Boston Black Hospitality Coalition, along with other groups of people, are really helping to create space for conversation and for getting on the same page about these things.
Now, one of the things that you were able to do during the shutdown is to become one of the restaurants that offered food for communities in need, and some of that was grant funded. Now, this is the methodology that Jose Andres of World Kitchen would like to see happen for so many restaurants. Like, this is the way to do it. Like, the state, the feds pay restaurant owners locally to provide the food that we can see people in line to get and very much need. Would you speak to that?
Yes, we've done a couple different sort of formats of this community work that is donor funded. We did partner with Off Their Plate, which is now a national organization that helps restaurants provide meals to hospital workers. So we were sending hundreds of meals every week to the Faulkner, to the Brigham, to Pine Street Inn and Boston Healthcare for the Homeless. And more recently, we have started working on a project that activates the restaurant supply chain in a way that allows us to provide free groceries to families in need. And so in the last 3 weeks, we've sent about 25,000 pounds of food straight to the doorsteps of families in Everett, mostly immigrants, some undocumented, and many of them either working essential jobs that are putting them at significant risk or unable to work for other reasons. And so while we wish that the government were doing more to support these families, we do recognize that we have this opportunity as restaurants and food businesses to help close some of that gap. And so we're eager to scale this model and to see what else we can do to make sure that people don't have to leave their homes unnecessarily and that they have enough to eat.
So, Jonathan, last week there were a number of folks testifying on Capitol Hill before the House Ways and Means Committee about impacts of COVID-19 on minority businesses particularly and communities. Ibram Kendi, who is a professor at the American University, said that COVID-19 is really a racial pandemic within a viral pandemic. And so his concern was, as were other experts testifying, that this plays out in the reopening. And you saw more of that in other areas that you asked your African-American voters about in the poll. I wish you'd explain that to us about some of their concerns.
Yeah, I think that hits it on the head. when it comes to African Americans and reopening the economy, there's the sign of optimism is the fact that African Americans are really embracing the safety precautions. But the negative side here is that we've been so negatively impacted. You have about almost 1 in 4 African Americans have had some sort of contact with the virus already, whether it be contracting it themselves or having a friend or relative or someone that they know in their household who has actually contracted COVID-19. If you think about African Americans when it comes to everything from, again, going back to being against opening the shutdown, concerns over being placed in the front lines already as essential workers. I think the estimate is about 2 in almost every 4 African Americans are considered essential workers and have already been thrust into the front lines. And that's one of the things that has also explained why we've seen so many African Americans disproportionately affected by the virus in and of itself. So we're on the front lines and we're being exposed at high rates. We have very major concerns over, we find in our poll, African Americans are very concerned over whether or not that they would be treated adequately and fairly, whether or not they would get adequate care at hospitals, whether or not their health concerns would actually be meted at a rate that would be comparable to our white counterparts, should they be either exposed to or even contracting the virus personally. So given the fact that we're scared about whether or not African Americans would get proper treatment, we have concerns as to whether or not the elected officials are actually concerned about African American communities when it comes to combating COVID-19. And then again, the fact that so many of us have people that we know in our families and in our households who have had exposure to the virus, given also the fact that we're on the front lines as essential workers, it really creates a myriad of problems for African Americans when thinking about going out and patronizing businesses, and especially as workers, as employees in Black businesses. So there are a lot of concerns for sure.
And I just want to highlight one other thing, because the question of masks came up in your survey. And as we know, that's an essential tool for everybody's reopening, all businesses, all communities, the scientists have said, and yet that's become politicized, Jonathan.
It has indeed. Science has become politicized. Taking safety precautions has become politicized. But what we're seeing, and what I think is one of the more promising findings in our study, is that African Americans overwhelmingly support the idea of wearing masks in public, even amongst younger African Americans, age 18 to 34, which is considered a group that you would expect to be relatively careless when it comes to taking these safety precautions. There's a disproportionate effect that the virus is having on older Americans and younger. We've seen video footage gone viral nationally of young folks in America being very careless and reckless when it comes to interacting with people during this COVID-19 crisis. But the fact that, in our poll, 76% of young African Americans feel safe wearing a mask in public or emphasizing wearing masks in public, and this is consistent across age groups. I think this is a sign that as a group, as a collective, we are really taking the COVID-19 virus seriously and are really embracing the idea of taking extreme precautions as the economy and really the country starts to reopen.
Okay. So, John Cruz, we've established that you have an established business, and you, though worried, you were not concerned about not making it. But there are many minority businesses that are not going to make it in this reopening. What do you see as you look around because you interact with other entrepreneurs of color, and are they able to come along with you in this reopening, or are you concerned?
Well, no, I'm very concerned. And in fact, I was trying to figure out, I'd say melancholy, down, but having been in the business as long as I've had, involved in a lot of business associations, especially contracting, but being involved in the business and the networking of minority businesses, I really think I was grieving for the death of what I see of many minority businesses. I don't mean to be melodramatic, but it's going to be hard for a lot of the family-owned businesses to survive this catastrophe. Okay. And they've already maybe had their life savings and what they started. So I just, again, that's I don't know what else to say that the worst is yet to come because we don't know the result of this quite yet.
Right.
We're not through it, but I believe it's going to be a serious blow to Black economy and Black businesses.
And Nia, one of the things that you're concerned about is that people are thinking about reopening as kind of like a few days, but you're looking long term, and you've already said you don't think you can even see maybe a little light for 6 to 9 months, maybe even then.
Absolutely. I think that, when we hear whatever announcement comes out on June 8th, again, we're pleading with the government and, state government to give us some guidelines prior to June 8th. But I know that, I feel like when we hear what's going to happen on June 8th, it probably really is not going to bode well for restaurants in terms of what they're laying out for us. And like I said, and Irene would know as well that the summer is really tough here already in the city. And so as we continue to fight this pandemic, I don't see that July, August, and September are going to give us good numbers. I also think that we're going to be waiting to see what the universities in our area, again, another population that we depend on, what they're going to do. And I know that there are some universities who are making early decisions, but that's also going to play a part. And so we're going to be combating this all the way until December, I believe. And when we talk about what normal looks like, I don't think we're going to see that until 2021.
Yeah. Well, Nia, you said earlier that you got a lot of business from students. Irene, I assume the same is true for you. And I should say that we're taping the show hours before there's supposed to be some guidelines released by that committee I referred to earlier, specifically for restaurants. So we don't quite know what those guidelines how they will impact you. But I would like for you to sort of answer the question that Nia has projected down 6, 9 months. Do you see the same thing for yourself?
I do see the same thing. I think Nia is absolutely right. Again, May is a really small restaurant, and I think the idea of social distancing and creating appropriate barriers between people would bring our capacity down to maybe 10 or even 12 diners. And we have an open kitchen, which we think of as a perk in many ways. But in the case of airflow, HVAC, that is definitely an obstacle for us. And, generally, I just feel that there's still so much we don't know about how this virus works, so much we don't understand about how air conditioning and the spacing of people is going to impact the spread. And we are in a position to really make a big pivot, which I know is a privilege that we have to try to be something other than a restaurant or more than a restaurant. So for us, we don't see ourselves reopening the dining room in 2020 at all.
Wow.
I don't know what happens after that.
And I understand you've had quite success with your online dumpling classes, which you're going to continue. Yes.
The dumpling classes have been a bright spot for us, in this very difficult time. We have staff who are now working remotely, but they can still connect with us and with our guests by bringing people together over dumpling making. We had an incredible time on Mother's Day when my mother and sister and my niece, who are in North Carolina, signed on to make dumplings and pancakes with me and lots of other folks and their moms. So it's all about finding, I think, the new ways to get those feelings of sort of comfort and communion that we used to get at restaurants, finding a way to provide that even in this very sort of difficult and strange time.
Well, at least you're looking forward in some way because it's just there's so many unknowns. I'm not quite sure. I know you all don't want to look down the road and see anything other than you've made a success out of it or figured out how to be resilient, but. Either of you, neither one of you, Nia or Irene, I don't think lived through the Great Recession. I know John Cruz did, came out on the other end. But this is tough times. What's the light for you, Nia Grace? What do you see that could help you?
Much like what Irene is doing and going online and trying to figure out virtual experiences. Again, a lot of our business was about being here and experiencing the multi-sensory that we had to offer, especially with the music. And so soon come down the line, you'll start to see things that we're able to do with live music. Really trying to, that's also another population here in the city of Boston that has been devastated by this pandemic are the live musicians that are out there at different venues. With the venues closed, that's tough for them. So one, we're really looking to partner with them and bring them back to the community in that way. I also am trying to do more with family meals, understanding that, family time during this time is really important, and bringing that home. Those are the two kind of bright spots that I see, but it still looks a little dim. We're in a part of town with we have a smaller venue, but it's not small enough that we don't need the capacity and we need the occupancy. So again, with the summer months just being few, hoping that the weather is good, hoping that we are able to get some of the leniencies that the city of Boston is looking forward to in terms of outdoor dining and spacing. That is what we're hoping and looking forward to. If we're able to make it through the months with those added avenues, that I think we can do it to the end of the year.
Okay. Well, the one thing we do know about communities of color, they're resilient. So I thank you all for joining me. That's the end of our broadcast and the end of our show. Thanks to all of our guests, and thank you for joining us. Stay with us right now as we continue our conversation on Facebook and Twitter. We are